Hi everyone, this is Dr. Garner again. We are talking about favoring the hip after surgery, or maybe you haven't had a repair yet. This can also apply, but it particularly applies for everyone post-hip scope. Here we go, this is what you look for. There are lots of things to look for. We're gonna start out with our feet wider than hip width, because we're going to work towards a squat. Now I'm going to just do a quick squat so you don't have to do it with me yet. I have a patient here with me who's donating her body to science for a moment, so I appreciate that. We're working to this squat, okay? But what happens when you go into the squat is, I want you to put on, if you don't already, pause the video, go find some leggings, jeans, whatever that have a middle seam that you can really follow. Okay, I want you to follow the middle seam right at the crotch. When you go into that, you'll usually find that, this is after you're done with rehab and things just kind of aren't feeling like 100% yet. When you come into that squat, I want you to first watch the knees, okay? Make sure they're not collapsing inward at all. That's an easy one to see. So make sure that the knees are staying kind of head on. It doesn't matter whether your feet are turned out, straight ahead. I want you to do what's comfortable for you. Okay? There's a more scientific answer to that. That comfort level is what matters. So you point the toes wherever you want. As you come into that squat, don't round out, don't collapse. Okay? Stay in neutral spine. Knees here are going to come ahead of the toes. There are some squats where we'll squat backwards. That's not what we're doing here. This is not going to be a backward squat. This is going to be a forward squat where the knees pass the toes. Now, watch that center seam. So in staying neutral, don't let the knees collapse. Watch your center seam. Notice at which point you start to veer away from your surgical hip. Then try to self-correct. Stay in the center, stay in the center. If you start to get pinching as you come all the way down, stop. That's where you need to see a PT for joint mobilizations. They should be, if they're a good pelvic and hip PT, be able to help you work your way out of that. If you can't find one, feel free to contact me. You want to be able to come all the way down with that center seam right between the feet, not favoring the other hip. That means don't veer away from your surgical hip. No pinching, no groin pain, no hip impingement feelings at all. Once you're here, I want you to shift the weight from side to side, okay, until you end up with the center seam, okay, of the crotch right between the feet equally. Now I want you to notice which plantar fascia under the foot feels tighter. It's probably going to be your surgical side, okay? And she's saying, yeah, it's my surgical side.
Definitely.
That may never go away, but it is something that you will constantly need to attend to and treat. Next step, okay? So first step is, just as a review, you're into that chair, so we'll do it one more time. You come into that chair, you watch and make sure my knees are not collapsing, my knees are allowed to go past my toes, I stay in neutral. As I continue forward, I look at the center seam of my pants, make sure that it stays in the center seam. As I come all the way down, no pinching, no pain. If you have groin pinching, pain, aching, again, you got to get that treated. That's a PT thing, okay? Now center up your center seam. Shift from side to side. That surgical side's probably going to feel tighter. And this is our last step, is to start to vault over the toes. And I'm going to turn to my side. You can stay where you are. I'm going to turn to my side so you can see what I'm doing. Vault over the toes and stretch out the fascia. Just create some elongation there. Back and forth. Now I have shoes on, but they're pretty minimalist shoes. So if you're wearing thick trainers, you know, something like that, you might end up taking them off to get a deeper, to get deeper mobility. I don't really call it a stretch. This is more of a fluid flossing. And you can even put more emphasis into, let's say my right side is, the scope side. You can put more emphasis into your right side as you go up and over. And use a really deep breath on the inhalation Imagine the pelvic floor stretching as you inhale and go over to the hands. And exhale as you come back down. So one more time, inhale. Pelvic floor stretches, the back ribs expand. This looks like the entry to an arm balance, right?
Yeah.
Which it can be, that would be next. And exhale as you go back down. Inhaling one more time. So yeah, it kind of looks like crane, right? You could just kind of pop over and whoo, go into an arm balance. If I didn't have this slidey sweater on, I might be able to do it. Yeah. But instead of crane, which is we'll save for another day, we're just doing that fluid mobility. You want all the toe and fascial mobility possible. Now, just for the transcendental icing on the cake here, we're gonna swim out the pelvis. You should be able to swim. Kind of imagine doing a pelvic clock. So towards the camera is noon, over to 3 is the right hip, 6 is sitting back in a squat, 9, left hip, and 12. And then roll it out in the opposite way.
Are we keeping our feet planted while we're doing
You
it?
don't have to keep your feet planted, but if you can, great. Yeah, you don't have to. Like by the time I get up to 12, one of my feet are up a little bit. And then we'll work our way back up and out. So why is that important? It's important because through fascial lines or fascial planes, the inner thigh muscles that go up into the pelvic fascia and they travel on up, that's it, we'll say that for another day. But the reason it's important for the hip is that from the pelvic fascia down into the inner thigh, or what's called adductor fascia, down through the inner part of the knee and into the plantar fascia of the foot, it's all connected. So if you're really struggling with chronic tightness and pain up here, you got to address foot mobility and that fascial fluidity and mobility. All right, hope this helps. See you next time.